Welcome to Health or Consequences, the monthly podcast series on Massachusetts healthcare and public health policy issues that runs under the Codcast label on Commonwealth Beacon. I'm Paul Hattis, Senior Fellow at the Lown Institute. Normally, I would next note that my co-host is John McDonough of the T.H. Chan Harvard School of Public Health. But things are a little bit different today, but don't worry, John is here. But he will be an interviewee today along with another very special guest who I will introduce in a moment. Reason for this role change for John is that today's podcast is devoted to recalling key aspects of an event that happened 20 years ago this month in our state, the passage of the groundbreaking Access to Health Care Bill, Chapter 58, sometimes people know it as RomneyCare. A process that John was very involved with as Executive Director of Healthcare for All at that time. There's a number of celebrations marking the 20th anniversary occurring over this week, including the state's main event at Faneuil Hall, happening in fact the day that this podcast is being released. Those events will bring forward many of the governmental leaders who were involved in Chapter 58's passage and early implementation. And though the consumer voice and perspective about that historic event and how it came to be will be part of the Faneuil Hall celebration and other public presentations, we should all be delighted that part of that will come from John as well as from Reverend Herman Hamilton and Rabbi Jonah Pesner, who were then active in the Greater Boston Interfaith organization. But it seems even more wise to use this month's podcast to have a discussion of the Chapter 58 journey that takes a deep dive into how consumer-led policy design and strategizing, combined with grassroots organizing under a moral framework, can lead to important state health policy changes like Chapter 58, changes that don't solely rely on the initiative of government officials or well-heeled health system elite insiders, but in fact can be shaped by real people with great ideas and great organizing skills. And so to help with that, we've invited to join with John in the retelling of key events tied to Chapter 58's creation, Cheri Andes, who today is an independent consultant, but back in 2006, Cheri was the lead organizer of the Greater Boston Interfaith Organization, or GBIO as I will call it. Cheri is someone who I first met when I first got connected to GBIO at one of their actions focused on more affordable housing some 23 years ago. And so today, Cheri, I want to welcome you to and joining with John as guests. And please say a few things, if you would, about yourself and about GBIO for our listeners' benefit.
Great. Thanks, Paul. And hi, John. It's great to be here with both of you today. Just a word, I was the lead organizer with GBIO and on staff there for 17 years. And GBIO is an organization of some 50 churches, synagogues, and mosques that work on multiple issues. And during my tenure and during the healthcare reform campaign, GBIO was affiliated with a national network called the Industrial Areas Foundation, IAF, which is a national network founded by Saul Alinsky. It was an honor and a privilege for me to work with GBIO all those years.
So let's get started. John, please tell our audience how the idea for a health insurance access bill in the mid part of the first decade of this century came about and the process leading up to it. And how was it that you came to reach out to Cheri about GBIO joining with Healthcare for All and other members of a coalition to work together on this issue?
Well, thanks, Paul. And hello, Cheri. Great to see you. We have lots of memories from those years together. So Massachusetts had a history before 2006. Chapter 58 was not a de novo event that just through spontaneous generation came about. There'd been a lot of serious policy work done and advocacy. I put it going back to the mid-1980s, particularly 1985 when Healthcare for All was first formed. There were two enormous health policy landmarks before 2006. One was 1988 when Michael Dukakis was governor and the state passed a intended to be a full universal coverage law that laid down many important foundational elements. The major parts of that law never got implemented, particularly the employer mandate on all employers to cover their workers, but it did lay some important groundwork. The second one came in 1996 when Bill Weld was governor. Bruce Bullen was running the Medicaid program, and we put through the legislature. I was in the legislature at the time, chairing the Joint Committee on Healthcare. We put through a major bill that totally reinvented the Massachusetts Medicaid program into what is now called Mass Health. And we laid down many foundational elements there, one of which was an agreement with the federal government to provide a lot of extra supplemental funding to support Massachusetts' innovative Medicaid structure. And those were annual amounts of money coming into the state. In 2004, the Bush administration, George W. Bush was president, Mitt Romney was governor, and the Bush administration was feeling budget pressures, and they informed the state in 2004 that those supplemental payments, which at that point were equaling about $385 million a year, or over a 3-year period, over $1 billion, were going to end. That created a sense of crisis within state government and across the healthcare sector. And there were many people, including Healthcare for All. We were already working on our own reform design, but that was kind of a focusing event in political science terms that galvanized attention. Prior to that, in 2003, Healthcare for All started thinking about where are we at, where are we going. We had a new governor then in Mitt Romney who seemed to have some interest in healthcare access reform, but he went back and forth. It was not clear. And we decided in 2003 that we were going to launch a major campaign and pull together a large coalition and aiming at 2006 as the year of decision, the year of opportunity. And we called the coalition Affordable Care Today. And Affordable Care Today included grassroots organizations like Neighbor to Neighbor, labor unions like the Service Employees International Union and building trades unions. It included big providers like Boston Medical Center and Cambridge Health Alliance. And we started working very hard on crafting an agenda that we would advance to the legislature beginning in 2005 for action in the 2005-2006 session. So the bottom line is there's a long history here before 2006 happened. And there was smart and informed advocacy working with people all over the state and already building coalitions. But Affordable Care Today, or ACT, was one of the more important that I think we've ever seen in the state's history.
And how did you come to outreach to Cheri during that time, John?
So we were building ACT. We were putting pieces together and working with all kinds of people. One of our key allies was a guy at Children's Hospital by the name of Josh Greenberg. And Josh Greenberg told me sometime in the summer of 2004, said, hey, you know, there's this organization out there, the Greater Boston Interfaith organization. They've been working on housing. They're looking for some other issues to get into. Maybe they might get interested in this campaign. And I said, yeah, that sounds great. And I think I almost immediately reached out to Cheri and we set up a meeting. If my memory serves me correctly, it was on Labor Day in 2004. And we met at the GBIO offices in Upham's Corner. And it was this big set of offices, nothing fancy, but a good size. And it was just the two of us. And I think we talked for about 2 or 3 hours that day.
All right, Cheri, let's hear your version of what happened that day from that outreach from John. And what was GBIO thinking about around that time of when John reached out to you?
Yeah, thanks for teeing that up. I remember that day incredibly well. So first of all, GBIO had worked on affordable housing as kind of our inaugural issue. We had gone on from there to work on three really important campaigns, a campaign around the civil rights of nursing home workers, where we had really heard about how nursing home workers inside of that campaign had heard about how they were working very hard, long hours, but also could not afford their health insurance that they were offered. We also had run recently a campaign called Moving from Debt to Assets, where we had worked with people in low income and communities of color, helping them to learn how to both save money for their future and get out of debt. And we had similarly heard about high medical debt. And we had just run an expansion campaign in the suburbs, the north suburbs and northwest suburbs of Greater Boston, where we had heard a lot about how suburbanites were losing their jobs as a result of the 2001 recession and becoming consultants without health insurance. And their kids were graduating from college without health insurance. And so when John walked into my office that Labor Day of 2004, I was contemplating the wrapping up of these campaigns. And I was contemplating how could we bring the whole organization together under one campaign in a way that would really begin to unite the organization. And John raised this issue of healthcare, and I immediately was sat right up, and I started to grill him and say, could it help the nursing home workers? Could it help the suburbanites? Could it help the people in our debts to asset classes? And what impressed me about John was four things really. He had an analysis, which he just referenced, this idea that Romney's interests and the fact that the 1199 waiver was up for renegotiation, et cetera, et cetera. He had a political strategy. He was putting together a powerful coalition. He was thinking about the ballot initiative, and he had a policy, not a perfect policy, but a policy that could potentially help our constituents. And so those three things together, rarely, really never had anyone walked into my office with that package and said, hey, you want to join a coalition, our coalition. Usually people came into our office and said, hey, you want to join a coalition? And they had a couple signs. So somebody coming into the office with that package at that moment in time, and to boot, his mother had been James Michael Curley's domestic worker. And when he told me that nugget, I was like, this guy is the real deal. So I was like, I got to talk to our leaders. And so we began a conversation with the leadership of Greater Boston Interfaith to see if this was something that our entire organization could get behind.
Now, John, Cheri mentioned that the initial foray policy-wise was actually a ballot initiative built around this issue. Tell us about that.
So I had observed over many years in Massachusetts politics the increasing use of the ballot initiative, not so much to win a law on the ballot, but to use the threat of an initiative as a way to force action that otherwise might not occur. And so our team at Healthcare for All with the Emerging ACT Coalition, we saw the ACT Coalition, Affordable Care Today, as a legislative coalition. And we decided that it would be helpful in a variety of ways if we could frame and advance an initiative petition for a law that would go before the voters in November 2006 in the event that the legislature was unwilling to do anything. And we would try to force it there. And I remember going to see Cheri and talking about that right away. I was a little nervous, frankly. I was concerned that if I talked about the ballot initiative, it might scare her off, or her members might be averse to it in some way. And I was shocked that she said, no, in fact, that's one of the most attractive things that you're talking about, because you're going to give all of our members something real and concrete to do, which is go out all over the state and collect signatures. And so that was a magic part of that first meeting, that sense that that they saw value in doing it. We were pretty clear all along with just about everybody. If the legislature could go through and pass a decent law that we were confident would be implemented effectively, then we would not put the state through the full ballot initiative. This was a safety device in case they ended up with a failure and nothing happening.
Cheri, what do you remember about that ballot initiative for GBIO and its involvement?
I remember three things. I remember us standing up at a meeting at Temple Israel in front of 1,000 people and pledging that we would collect 40,000 signatures. I remember John's jaw dropping. I remember those 40,000 signatures needed to be collected by mid-October, and in and around mid-October. And I remember mid-September coming, and we only had 15,000. And I remember us being at an assembly of our internal assembly of our members, and Jonah Pesner standing up in front of 200 GBIO members and saying it was a heshbon nanefesh moment, and blowing the shofar. And then he explained what a heshbon nanefesh moment was, and it is a moment of gut check, of moral reckoning. Do we really believe what we say we believe? Are we going to put our bodies on the line and deliver on what we say we care about? And really that meant get your ass onto the streets and collect those signatures. And we came through and collected 52,000 signatures at the end of the day. So that's the third thing I remember.
So we collected 130,000 signatures over the course of the campaign. And I'm proudest of the fact that every single one of them was done with volunteer labor. No paid signature gatherers at all. The other event that just sticks in my memory so much is June 2005, when our legislation was before the Joint Committee on Healthcare Finance for its public hearing. And Romney was presenting his bill, and he got to go first, and then our bill was up. We overflowed Gardner Auditorium with more than 500 people. And Governor Romney came with his team. They testified. Everybody was very polite to him, but it was our bill that captured the day. And what was wonderful about it were the GBIO leaders. They had a huge assortment of people who were there, and every minister, priest, rabbi, every member of the clergy came in their full, ostentatious clerical regalia and walked around the State House leading teams. And, in a way, it fits with the poor people's lobbyist, Judy Meredith's commandment to always think of central casting when you're doing hearings and things like that. But as I thought more and more about it, yes, it was that, but it was also making a statement. And it was a statement that, yes, this was an economic and a policy and a health industry issue of concern, but this was also a moral, values-based issue. And GBIO's presence in this was extraordinarily potent in communicating that message to everyone every single day.
So as you were out collecting signatures for the ballot, not knowing what for sure would happen with the legislation, you went into that legislative session. What were you hoping for? Where do things stand as that session began in terms of the ACT Coalition's thinking?
we had a lot of uncertainty. We had a good base of members, but we had a brand new House Speaker, Sal DeMacy, who had yet to make clear where he was at. He hired someone who I've worked with very closely, a woman named Chris Hager, who was his health policy advisor, and that was a very good sign. He had some real talent. I remember Rep. Christine Barber, who is running for the state Senate right now in Somerville. She worked on the House Healthcare Committee staff as an analyst, so lots of good people. But Governor Romney, he wanted a big bill. However, what he wanted was really skinny coverage. It was not a strong benefit that would have provided the set of services that people really need when you think about what is health insurance for. And then we had tensions with the Senate President Travellini at the time, and so there was uncertainty. But that's the name of the legislative game, and I spent 13 years in the legislature, and so it didn't intimidate me or my team, which was full of experienced people. And we had a fabulously loyal set of organizations that were part of the ACT coalition. By the way, the legislative fight was called the ACT coalition. The initiative campaign, the ballot initiative, we called that Act 2. Just to differentiate, because there had to be a real legal distinction there. So that's how we organized it linguistically.
Now, Cheri, healthcare legislation and all its complexities and ins and outs somewhat new to GBIO. And in the midst of all the issues that came forward was this discussion about an individual mandate. Okay, what do you recall about that issue and the discussion that went on within GBIO and other places there?
Well, what I remember is when it came up, it wasn't particularly popular with our leadership. It was kind of problematic, it was initially it was really an idea that came out of the Heritage Foundation. In fact, when health reform passed and Faneuil Hall, Governor Romney, orchestrated his celebration at Faneuil Hall, where he was kind of floating on air. The people who were there were Governor Romney, Senator Kennedy, Speaker DeMacy, Senate President Travellini, and a guy named Dr. Robert Moffat, who was a senior fellow at the Heritage Foundation. He was the fifth wheel on the stage because that's where the individual mandate had come from. So we weren't all that excited about it. There was real concern about whether the nursing home workers would be penalized for being poor and not being able to buy their insurance. So it got us very invested very quickly in affordability and the question of what is going to be affordable in this state? How is it going to be defined? Because the mandate did not say everyone must buy insurance. It said if a product is affordable and creditable, then you must buy it. And so GBIO became very singularly focused on that question. What is going to be determined to be affordable? Because we didn't want people to be penalized for being poor.
Now, Cheri, in addition, in the midst of that sort of legislative debate and policy discussion, there was a House Senate Conference Committee stalemate about how much employer responsibility and monies coming from employers should be included in the bill. And I recall that Speaker DeMacy actually came to you in GBIO to discuss his views. What do you remember about that whole set of discussions and with him about this?
So there are two key stories here, one short, one longer. The first is that we invited Speaker DeMacy out to Bethel AME Church, Bethel African American Episcopal Church, where Ray Hammond is the pastor, Reverend Ray Hammond. And we asked Speaker DeMacy in front of 350 of the congregants there, will you pledge to stand up to the business community? Yes or no, Speaker? And he said, yes, I will. And Pastor Ray Hammond took his hand and raised it up in front of 350 people. And Speaker DeMacy yelled, "Hallelujah." And that there's a picture of that in the paper. And so that was a hero moment for the speaker. That was in December of 2005. Fast forward to March of 2006, and the speaker was a bit on the ropes. Public opinion was starting to turn more towards the Senate president's version of the bill. And GBIO's office got a call from the speaker's press secretary back in the day when offices had phone numbers. And Speaker DeMacy was asking GBIO to hold a press conference outside the Senate president's office, putting pressure on the Senate, declaring that the Senate president was putting the lives of thousands of members of the Commonwealth at risk because of his intransience on the business mandate. And we were inclined to do it. But we were also members of the ACT coalition, and we knew that we needed the consensus of the coalition to do something that controversial. And so we went to the ACT coalition, and there was some hesitancy. And so, because other members of the ACT coalition understandably had legislation in front of the Senate president other than just the healthcare bill, and to put that much pressure on the Senate president was understandably difficult for them. And so we had a meeting with the coalition, had a meeting, a critical meeting with Speaker DeMacy in his office. And the speaker came in late, and he pounded his hands on the table, and he looked at everybody in the room, and he said, "Let me ask you a question. How much of the Senate president's bill is in your bill? 80%, 90%? And everybody kind of put their heads down and said, "Oh, no, Mr. Speaker, 5%, 10%. And then he shook his finger at us and said, "Why won't you say that?" And then he said, "And how much of my bill is in your bill? 85%, 10%? And we said, "Oh, no, Mr. Speaker, 90%, 95%. Why won't you say that?" And then he looked around the room and he said, he looked at Reverend Herman Hamilton, another blackballed pastor, not Reverend Ray Hammond. And he said, "And I came out to your church and I said, promise to stand with you and the business community. And I have kept my promise. And now I'm asking you," and he pointed to everybody else in the room, "to stand with me. And if you do this, we will win. And if you don't do this, we will lose." And then he left. And so we had a little evaluation, and the coalition partners said, "Yes, GBIO should do that press conference." And so we did. And I believe that it did make a difference. We got a better bill because of the pressure that we were able to bring to bear on the Senate president in that moment.
Thank you for that story, John. So the bill passed, and the coalition then began to focus on the newly created connector under the management of John Kingsdale for its implementation. What do you remember about that phase?
So we were building something brand new that didn't exist anywhere in the country. I remember visiting John Kingsdale and his chief of staff, Rosemary Day, when they were the two only employees at the connector. I mean, this was built out of nothing. And it had a high level of commitment from Governor Romney, the legislative leaders. Everybody wanted this to succeed. I do recall at one point, Kingsdale, it was kind of an independent agency. He had a higher salary than is normal in state government. And I remember there was one writer from the Boston Globe who the editors were telling her to go after this. It's a waste and a boondoggle. Maybe this is the next big dig. And she got Kingsdale's salary, and she called me up and she said, "Here's his salary. Do you have any comment on this?" And I said, "Yeah, this is not amateur hour. This is not a time to do this on the fly. We need, Kingsdale took actually a major pay cut. relative to what he was making before he came here. And we've got to be serious to do what we need so that we build this so that it's going to be built to work and it's going to be built to last. And so so the story ran, but it was a one-day wonder story that nobody paid any attention to after that.
Now, Cheri, in that implementation phase, GBIO became the lead organization working on what was known to be the affordability schedule that John Kingsdale and his limited staff had to try to create in terms of what people would actually pay based on income levels for their connector care insurance. How was it for GBIO to be sort of central in that issue, and how did you feel about its involvement and where things ultimately came out?
We felt that the question of affordability was really almost as critical as the legislation itself. We felt that we had to get this right in the state of Massachusetts, and we put a tremendous energy and effort into that campaign. And it's probably a whole show in and of itself to really do justice to how that all went. But in the end, we felt very good about the work that was done and the result. We felt like the affordability schedule that was developed was progressive, was supportive of both low and moderate income people in this state, and has continued right up until January 2026, when it's beginning to be seriously eroded by the President of the United States of America.
So there's a key factor, a political factor that was going on. This was playing out in the spring and winter, late winter and spring of 2006. And at the start of the year, at the very end of 2005, Mitt Romney announced that he wasn't running for re-election in 2006. And so we knew there would be a new governor. And as we were making our choices, our decisions about what to support and not to support and how hard to press and so forth, we knew that it was very likely that there would be a new governor, and chances are it would probably be a Democratic governor, and perhaps this guy Deval Patrick, who was running and showing a lot of strength and attractiveness. So the affordability issue that Cheri's referring to, that didn't get resolved until Deval Patrick came into the governor's office. And the negotiations happened between GBIO, HICFA, the ACT Coalition, and the Patrick administration. And it was a much easier sale to make to those folks. And that was a conscious, deliberate strategy that we thought it would be a different situation. And so we wanted to make sure that it got pushed back into that scenario.
Now, John, after all of this success with Chapter 58, you ultimately went to Washington, joined Senator Kennedy and the committee staff to work on what ultimately became, in 2010, the Affordable Care Act. How was that federal experience similar or different than what you had encountered in Massachusetts?
So the bill, when Romney signed it, got enormous attention nationally and even around the globe. At that point, everybody knew that Romney was going to be running for president in 2008. And this was going to be one of his signature pieces that he would bring to say, look what I got done, look what I got done. And one of the stunning pieces was just how bipartisan it was. Democratic legislature, Senator Kennedy, Governor Romney, President Bush, and the Affordable Care Act process started out that way as well. A lot of bipartisan energy. And then in President Obama's early months, a new political entity formed called the Tea Party, which was really an early version of MAGA, of President Trump's MAGA group. And they polarized Obamacare. They created the term Obamacare. They started calling it that to try and undermine it, because if you don't like Obama, then you won't like this. So politically, it was night and day. And we were under different constraints in DC than we were in Massachusetts. In Massachusetts, we were able to create an affordability schedule. Cheri and her team in particular were able to do that and weren't looking at an overall budget constraint or budget level of saying, what's going to make this work? What's going to be good for people? And the state had the resources through the federal government. In the federal level, trying to get the Affordable Care Act done, we had a budget limit of $1 trillion over 10 years. And when we priced out doing Massachusetts on a national basis, John Gruber from MIT did the analysis for us. It turned out that doing that would cost between 1.6 and 2.5 trillion over 10 years. And so the affordability formula in the ACA was substantially less generous than what Cheri and GBIO and ACT had won in the negotiations in Massachusetts. Massachusetts, when we joined the ACA, Governor Patrick put in money to maintain the affordability levels that we had pre-ACA. And the rest of the country did not live up to us. One reason was because coverage was just so less affordable until 2021, when Joe Biden became president and had Democratic House and Senate. And one of the first things they did was they brought the affordability levels in the Affordable Care Act up to the Massachusetts levels, the enhanced subsidies. Those lasted for 5 years until the end of 2025. And at the end of 2025, President Trump and the Republican House and Senate absolutely refused to extend the enhanced subsidies. So we've had a gigantic affordability fall off over the past several months now, and hoping that things will go better next year once there's going to be perhaps a Democratic House and a Democratic Senate.
Cheri, in our few minutes left, I'm going to start to turn this discussion a little bit more broadly than what had happened here. And as you know, there's other grassroots groups, ones that are like GBIO around the country, who work on social justice issues in different ways and in different subject areas. After Chapter 58 was passed and implemented here, what sort of lessons from GBIO's experience captured the most interest of some of those sister organizations that you would speak with around the country?
One of the things that John taught me at a little workshop at HICFA was something called the three windows theory. He adapted out of a John Kingdon analysis, a political theorist. Very quickly, if you want to get big change done, you need to take advantage of opening of three windows. When the problem, a large public policy problem window opens, and a lot of people are aware of something really big needing to change, a policy window where suddenly somebody has a good idea about how to fix a piece of that problem in a credible way, and then a person window or a politics window where a person or people have the political will and the reason to actually implement that policy to solve that problem. And when those three windows are open and held open long enough, you can drive big change. You can get it done. And so one of the things that I've done is I've helped my colleagues both recognize when those windows are opening in their communities, and also help them learn how to open them, how to use public pressure, how to use organization, how to use organized moral force to open some of those windows and keep them open long enough to make real change happen.
Thanks for that, Cheri. And my final question to both of you, and I'll start with John, is that we're now 20 years later. In the times we find ourselves today, where rights of immigrants and even the survival of U.S. democracy in moments feels at stake, what lessons from 20 years ago and the effort that you guys were talking about today seem most relevant today? John?
I would say we showed that it is possible for really a grassroots-led movement to be able to make a major impact on health policy and public policy. We saw it later, by the way, in Massachusetts, a few years following up that with the passage of the so-called millionaires tax, which had a similar kind of coalition structure and grassroots organization. But so, if anything, I think we are evidence and proof that, you can't always get what you want, but if you try real hard, you might just get what you need.
Cheri, same question.
So, as in most times when I'm in the same space with John, I agree with him, and that's I kind of wanted to lift that lesson up too, but I'm going to lift it up this way to say the 3 windows will open again, and organized people and people of faith need to be organized to help make that happen and to be ready to go through those windows and drive public policy change when they open. That's our job. That's why we're here. That's what it's about.
Cheri Andes, John McDonough, reflecting on 20 years after the passage of Chapter 58, which you both personally had important roles to play in. Thanks for your retelling and your sharing with our audience today. Thank you so much.
Thanks, Paul.
Thanks, Paul.